Sharon, you talked about intervention, and it has kind of an ominous tone to it, maybe because a lot of reality TV shows that are on right now. Tell us a little bit how intervention works at the Unicorn Children's Foundation.
Well, we don't provide the interventions ourselves, but we will provide resources and direct parents to other facilities that may provide the interventions. And from interventions, I'm talking about speech and language pathology, who may be helping if a child is not using words or has feeding difficulties, occupational therapist if a child is having difficulty regulating their senses, or using fine motor skills, developmental specialists who may come into the house and work with the parents on their interactions with the child. So there's a variety of different types of therapies that are available to help remediate some of these skill challenges that these children have. So I don't want to scare anybody thinking that we're talking about Dr. Drew and his interventions. Usually they're very family-oriented, family-centered, child-centered approaches that are delivered in a very humane and caring environment.
Excellent. Sharon Alexander with us, the Executive Director of the Unicorn Children's Foundation, and our show is Dare to Dream. And more families finding themselves in a situation where they may feel that their children are suffering from learning disabilities, or may have been to, as you said, the pediatrician or even to a specialist, and may have determined that there may be some learning disability. And again, that covers a broad spectrum. You talked about autism, also bipolar is also a phrase that's been used, and also, of course, ADD and ADDHD, and the list goes on and on and on. These are phrases that 20 years ago, even maybe 10 years ago, weren't even part of the language, and now they're just common knowledge. Has this always been a problem, and it was just we didn't know what it was, or we just thought they were difficult children, or is this something that's been relatively new, that's been triggered by something in our environment?
Nobody's really sure. We're seeing an increasing number of children being diagnosed or exhibiting these challenges. I think some of it is related to the diagnostic categories. They do revisions of the Diagnostic and Statistical Manual, the DSM, that on a fairly frequent basis. They're actually coming out with a new revision, I believe, this fall. So it'll be interesting to see what happens with all of these categories of behavior. So it's going to create some flow between diagnostic categories, where we're going to see increases in some and decreases in others. But the rate at which this is increasing and the number of children affected is just too strikingly large for it to be accounted for simply by changes in the diagnostic manual. Some believe it may be caused by, if you are aware that it's there, then you see it more frequently. That it might be that doctors and clinicians are seeing it more frequently, so they're noticing it more in other children who may have in the past sort of been termed the lazy child or the class clown. So there may be some of that, but again, the numbers are just increasingly large.
They're staggering.
Absolutely.
And what are you, I don't want to put you on the spot, but I'm sure you probably have off the top of your head what kind of numbers we're talking about, if you could share those with us.
Well, we're looking at 1 in every 91 children is being diagnosed with autism. We have almost 1 in 5 children being diagnosed with ADHD. The use of medication to treat ADHD symptoms has tripled worldwide. So we're really, it's not something that is local, but I will tell you locally, we have over 85,000 children in our public school systems between Broward, Miami-Dade, and Palm Beach County schools who fall into one of these categories. So that's a large chunk of your listening audience that's out there that are struggling every day, and we just want to make sure parents know that there is hope and there is help, and we really reach out and get in touch with us, get involved, get on our site, educate yourself, arm yourself. But you're not alone.
And that's great news for a lot of folks, a lot of reassuring news for folks listening. The website that Sharon mentioned is unicornchildrensfoundation.org. A lot of good reading. It's an easy read, easy on the eyes, but there's a wealth of information on there for folks who have already determined that they have a child or children, which is something else I want to touch on in a second, a child or children suffering from some learning disability or learning challenge. I like the way you call it, learning challenge. And also parents who feel that they may have a child who has some sort of learning challenge. There are a lot of great pages on the website with information for you to help answer some of your questions, to give you some things to look for, some behavior to look for in your children. And I wanted to ask you, because we hear a lot, is it true that if you have, say, a family of 4 and you have, say, the oldest child has been determined to have been suffering from some sort of learning disability, is it true that the other children, it's a good chance that they will suffer as well as from something? Is it something that seems to affect every child in the family? family or every other child, or how does that work?
There's definitely a genetic variable. We're definitely seeing higher outcomes or with families who have one individual affected with a disorder. There seems to be other individuals who might be impacted, but there are cases where we have twins where one is diagnosed and one is doing just fine. So it can't purely correlate down to genetic factors. There's got to be environmental factors that are coexisting with the genetic factors, and then you just get the right mix, and it just throws development off track.
Excellent. Sharon Alexander, the Executive Director of the Unicorn Children's Foundation, on the show with us today. The show is Dare to Dream. And Sharon, you were so nice to give me a list of questions before our show. And as usual, I completely ignored them and just, but when you and I sit down and start talking, I think we probably touch on a lot of areas that neither one of us thought of ahead of time.
Absolutely.
So I didn't mean to put you on the spot. But as the show starts to wind down and we start to run out of time, I'm sure there's some things that I wasn't able to cover that I didn't ask you about. So I want to just open up the microphone and let you take the last couple of minutes and share with us anything else that we haven't covered so far, because the Unicorn Children's Foundation does such a great job, and they do cover so many different areas, and there's so many different resources for parents and children and also professionals to utilize from the group. So share with us some things that we haven't covered so far, if you would.
Well, we've got a pretty full schedule this summer and great opportunities for families to get out and have their children screened for free. We've got a couple of programs, mobile screening clinics, one that we do in partnership with University of Miami, Nova Southeastern University Center for Autism and Related Disabilities, for short, UMNSU CARD, and also with Florida Atlantic University Center for Autism and Related Disabilities. These clinics go out into the community. They screen children for free. If there are any red flags, they immediately refer you to the appropriate organizations that can help you with further assessment and identifying appropriate interventions. As well, they also provide parent support and guidance. Those units are going to be available periodically at the Florida Marlins games. The first event will be on May 29th. Come on out to the ballpark. We've got the mobile clinic with the free screenings, chances to win fabulous prizes. We're going to have an online auction. We're going to have a raffle, a great chance to meet our newest partner, our Unicorn's official spokesperson, World Series champion Cliff Floyd, who played with the Florida Marlins. He's jumped on board because he realizes the challenges in raising children and the challenges with if you have a child with learning and communication disorders, what do you do then? So he's stepped up to the plate, no pun intended, to give us a hand and get our message out. They're going to be, you can look at our website. We will have the schedule of dates available. We also are going to have some family fun days at Boomers scheduled throughout the summer, where, again, we will have our mobile clinics available. Families can come out, bring their kids, have the children screened. They'll let you know if anything's off track. They'll give you the advice on how to correct it.
Excellent. Well, Sharon Alexander, it's always such a pleasure to sit and talk with you. And, of course, it's always a great pleasure to talk about the Unicorn Children's Foundation. It's a group that I feel very strongly about and one I'm very proud to have been involved with in past months and over the last couple of years. And I'm thrilled that we have a chance to sit and talk on our show, Dare to Dream. And I'm glad that it'll be a continuing basis. So we'll be covering a lot of ground over the next couple of weeks. So I urge folks to stay tuned and listen at this time each and every weekend and join us for the program. And again, the website, Unicorn Children's Foundation, I strongly urge parents and some young teenage children and also professionals to go to the website and utilize the tremendous amount of information and resources on the website that are available to you. There's a lot of great information there, a lot of helpful information, and it's a terrific website. And over the next days and weeks and months, that's going to be changing. So check back frequently as things change on the website as well. Let's get that phone number out there. If folks would like to volunteer their time, volunteer their talents, donations, do we take donations?
Without a doubt, we absolutely do.
And the phone number is?
8886-UNICORN.
Excellent. Well, Sharon, a great job as always. And again, it's such a pleasure to talk with you. I'm really looking forward to our show next week.
Sounds great.
What we do at Unicorn, your heart will understand.